My name is Natalie Tejan, and I'm a manager of federal policy in the DC Public Policy Office with AFSP, and I'm really excited to welcome our three panelists today. So our first panelist is Dr. Alfie Breeland Noble, and she serves as the CEO for the ACOMA Project and the ACOMA Center. Dr. Alfie lectures on topics related to helping racially diverse young people and the young at heart live mentally healthy lives with a primary focus on teens, college students, families, and communities of color. So Dr. Alfie, if you wouldn't mind standing and just waving to everyone that you're who you are. Our next speaker today is Sam Britton, and they serve as the head of Advocacy and Government Affairs at the Trevor Project, working to advance policies that support mental health and suicide prevention for the LGBTQ youth. And Sam as well. And then we have Tashia Arnold, who serves as the program coordinator for the Center for Native American Youth, and she is a member of the Quinault Indian Nation. So as we have a full panel today, we'll be taking questions at the end of their presentation. Oh, sorry, Tashia. And so you all have index cards, and we'll work to collect those to answer questions at the end. So I'm going to invite Dr. Alfie to come up to the microphone.
All right. Thank you, Natalie. Good afternoon. Y'all can do better than that. Good afternoon. Thank you very much. Look, I was just at, Taraja Henson had her event over the weekend, and I was there, and I always start like that because I have anxiety. And so when you are nice to me, that helps bring my anxiety level down. Okay, so yeah, so I got 7 minutes. I love to talk, but you would never be able to tell. All right, so I am here in wearing multiple hats. One I want to acknowledge is, as Natalie so articulately explained, the ACOMA Project, the ACOMA Center. One's a nonprofit. One is the other media and other kind of consulting work that I do. I'm a researcher at heart, and my focus is mental health disparities and trying to reduce the disparities that keep our young African American and Black folks and other young people of color out of treatment, right, which impacts suicide, right? So if you don't treat that depression, if you don't treat that anxiety, these are some of the issues, you know, it can lead to very bad outcomes for our young people. So what I'm going to talk with you, that's one hat, I'm sorry. The second hat is representing the Congressional Black Caucus's Emergency Task Force on Suicide Prevention and Mental Health in Black Youth. And that was an outgrowth of an event that I did with the Office of Congresswoman Bonnie Watson Coleman. I want to say her name very clearly because she's amazing. She saw the Facebook Live event that we did that was coordinated by her office, and she decided as a part of that she wanted to keep going. So I want to share with you briefly, I really do feel like I need to tell you who's on this task force. So we have Alma Adams from North Carolina, Emmanuel Cleaver from Missouri, Danny Davis from Illinois, Alfie Hastings from Florida, Johanna Hayes from Connecticut, Eddie Bernice Johnson from Texas, Barbara Lee from California. Everybody knows John Lewis from Georgia. I'm still waiting to meet him. I can't wait. I'm probably going to burst into tears. Ilhan Omar, our sister Ilhan Omar from Minnesota, Ayanna Presley from Massachusetts, and Frederica Wilson from Florida. And these are the members of the task force. You have to be a legislator to be a member of the task force. I am a member of the working group that works in partnership with the task force. I am a member along with a whole host of other luminaries of folks who do work in this space, who focus primarily on Black youth. And when I say Black, I'm thinking of African American, like me, African immigrant youth, and Caribbean immigrant youth, Black Latino youth, right? So if you identify as Black, we are really fighting for your needs. The other thing I want to mention to you is who the chair is of our committee. The chair of our committee is a brother by the name of Dr. Michael Lindsay, who's out of New York University. He runs something called the McSilver Institute for Poverty, research on poverty. So in terms of, you know, before I sit down, what I want to share with you is a couple takeaways, a couple points. The biggest is that everybody deserves an opportunity for optimal mental health. Everybody. Right? I won't say it doesn't matter where you come from, because it does matter. I want you to know I see you. That whole ideology about I'm colorblind, I want you to see me and still treat me right, right? That's the way we want to approach this, and I think that's what we're trying to do with our task force and our committee. Second, suicide prevention, I feel, is most effective when we consider the whole of a person's lived experience. So for Black and brown youth, youth of color, I'm thinking about my sister who's going to come up and talk about Native American youth. If we don't acknowledge the facts of racism, discrimination, homophobia, transphobia, right? All of the phobias as a part of the work that we do, we can't be effective. All right, so you know, we really, thank you. So we really have to be cognizant of everything that a person brings into treatment, particularly for our young people of color. All right, and then finally, the Congresswoman, I won't say this on behalf of her. What I will say is that I know that everybody on the task force and working group would be really invested and interested in having your support. So if you have ideas, I think my contact information will be available somewhere. Please share those ideas with us. If you come from communities where this work can be useful, please let us know that we can be useful to you, particularly those folks who come from the districts represented by the members of the task force. So I understand that Omar will have a big forum going the latter part of the summer, going into the fall, about mental illness, mental health, and suicide prevention for Black and brown youth. So those are the kinds of things we want to get your support around. It has been my honor to stand here and share with you, and I'm looking forward to Q&A. Thank you so much.
Good afternoon, everyone. It is so exciting to be here. I'm very loud with all of you today. As was said, my name is Sam, and I'm going to try to speak about the very broad issue of LGBTQ youth and how we're going to save young LGBTQ lives. We'll start with the clear facts and figures. As you know, this is a diverse population that covers millions of people. Which covers millions of people, all of who are going through different experiences. What I like to say is that in the beginning, God created the heaven and the earth, and LGBTQ people have been there since the beginning. Sometimes we've been hated, sometimes we've been loved. It depends on the zip code right now and the hour of the day, it feels like. And that is kind of where we begin this work, is that we are at risk. LGBTQ youth are 4 to 5 times as likely to attempt suicide as their heterosexual peers. If you are a trans person, the statistics are even more harrowing. Of our trans youth, 40% are saying that they have attempted suicide in their lives, with 90% of that 40% saying they did it before the age of 25. We just recently, well, we're gonna have data coming out in the next week, that if you've gone through horrific experiences like conversion therapy, and I'll talk a little bit more about them, if you've gone through those experiences, you have a 60% chance of attempting suicide within the year of going through that conversion therapy. We are dying. And I don't mean to be depressing, but that's where the system is. And the reason that we're not dying in larger numbers, in large part, is because of amazing organizations like the Trevor Project, the National Lifeline, Crisis Text Line, and others who are saying, we see you. Just as was said before, we see you, and we want you to know that you're not alone. This is the major challenge in my life. I was growing up a missionary kid in the wheat fields of Kansas, and there was no LGBT resource center. There was no space where I felt like I could go, so I founded one. I went to school, made one. They literally emptied out a closet to give it to us for our center, which was fine because that's a great amount of jokes. You have like jokes for years. And there is now the Samuel Britton LGBT Resource Center at Kansas State University because we got out of a closet. All of that is to say, the experiences of LGBTQ youth are once those of resilience. We are coming from places like conversion therapy. My parents tried so hard to change me that they sent me to a therapist who thought that with electricity and heat and ice, they could change me into a straight person. The problem? That is still legal in 32 states around the country. Many of you, though, are coming from states where we have recently passed bills making this a thing of the past. 18 states in the last few years have passed our laws working to protect LGBTQ youth from conversion therapy with the support of AFSP. But it's not, yes, clap, Tara, yes. The next word, though, has to be, this is a federal advocacy forum, not a state advocacy forum, so let's talk federal, shall we? We have 2 bills that you need to know about as you're going forward. Prohibition of Medicaid funding for Conversion Therapy Act. You can't use public dollars to hurt us ever again. The second, the Therapeutic Fraud Prevention Act. We will investigate you for the disaster of consumer fraud you are applying to my community in the name of conversion therapy. You need to know that what they are doing to us is not only wrong to you, it is wrong science. It is wrong to business. It's just wrong. And there has to be other spaces out there for our youth. So for example, if you're have a school, they need to have a suicide prevention policy. We at the Trevor Project now have reviewed over 4,000 school districts, and you should know that only about 20% of them even have the word suicide mentioned anywhere in their school policies. We're working to fix that, though, federally as well. HR 2599 will say that you have to have a plan in place if you are a federally supported school. And this is how we're going to do it. We're going to make sure that youth are seen. Now, that's a lot I'm trying to cover in a really short amount of time, and we'll end with some really good statistics. It is really, really empowering for me to know that we are now serving twice as many youth at the Trevor Project. Over 150,000 youth will contact us this year, and that number continues to rise. Now, you may be thinking, why in the world are you happy that people are calling you? Because they're not only calling us in crisis anymore. When your states pass these laws, we get boosts of calls of youth saying, I saw on the news that they can't put me in conversion therapy anymore. Is that true? And we get to say yes, because of amazing support with people from AFSP and others. We work together, and you are not at risk anymore. Now, we still have a lot of risks left. There's going to be a lot of work left to be done. I have to bring in a John Lewis story because they mentioned Representative Lewis, who is, again, idol. I was chosen as the Grand Marshal of Atlanta Pride one year. John Lewis is standing right in front of me. So I was like holding back as much as possible. You're John Lewis, I'm not getting anywhere near you, you're amazing. I'm in my stilettos. John Lewis jumps out of their car, walks beside me. He's like, if I can walk across the bridge and you can walk in heels, we got this together, babe. And that is how it has to be done, is federal legislators have to know that we are there, that we are going to keep being there, that you are all going to say that LGBTQ youth feel alone, that you're hearing these stories, you know these statistics. Let's change the statistics. I'll end with that. Let's change with the statistics so that way in the future when we come back to an advocacy forum, it's not about how many youth we're losing, it's about how many youth we're saving. Yeah. Awesome.
Bueno Guito, hello. Thank you for taking the time to be here to learn more about Native American youth and the challenge of suicide and suicide prevention in Indian country. I would like to preface and say that I do not speak for all of Indian country, but I will speak of what I know, my lived experiences, and of the work that I currently do for suicide prevention for Native American youth at the Center for Native American Youth. It's important to know the statistics. So American Indians and Alaska Natives, they have the highest rates of suicide of any ethnic and racial group in the country. That statistic has been steadily growing since 2003, and currently our American Indian and Alaska Native youth are committing suicide about 2.5 times higher than the national rate. So it's really important to know that. It's also very important to note that those that are committing suicide, that age is between 10 and 24. Those are our most at-risk youth in our communities. The contributing factors for this, it's very important to know this. So that's isolation, geographic isolation, that's reservations where they live. It also includes the urban centers that they're also a part of, because about 60% of Native Americans actually live in urban centers. We don't all live on reservations. So it's really important to know that geographic isolation is a very big key factor in suicide. Also, the lack of educational opportunities, the intergenerational trauma, bullying, substance and alcohol abuse, peer pressure, lack of economic development, and that's infrastructure for youth and communities. They don't have programs or activities that are for them that help get them doing something in their communities. There's just a lack of that in general in these tribal communities. And this is something that I'm very passionate about as a tribal member, as someone who's enrolled in a tribe. And also it's something I'm very proud of working at CNAY, because this is what CNAY was founded for. Senator Dorgan in 2011 founded CNAY for suicide prevention. And while that's at the core of what we do, it's really important to know that our work has really, really grown and developed over the years. We currently work in 4 pillars. That's very important to know, 4 pillars. So we work towards youth recognition, leadership and advocacy development, resource exchange, advocacy and policy in itself, and then also to build a Native youth-driven narrative, because that's very important. Native youth narrative. They need to be at the table whenever possible for these policymakers. They need to have that face-to-face time. They're the important ones. They're our leaders. They're our future. So I want to share some programs that we have at CNAY that are working towards suicide prevention in various ways. The first program would be our Fresh Tracks program. This is actually something fairly new for us. And this is bringing non-Native and Native youth into the same space to build cross-cultural communities and to bridge those gaps between these communities. Because what we find is that Native youth and non-Native youth often face the same challenges, whether they know it or not. And by bringing them into the same space, they're able to talk about these things. They're able to talk about the challenges and issues, and then they can come up with better, more well-rounded solutions. And Fresh Tracks does that by bringing them also into nature, because that is also a place of healing for many, many Native youth. Another program would be our core program, which is the Champions for Change program, and this brings 5 Native youth together from across the country. They are champions for a year term, and they have 1 week where they're brought to DC to get advocacy and leadership development and training, as well as communications training. And the highlight of their week here is that they get to sit down face to face with their representatives, with their senators, with their congresspersons, and have a conversation. They get to share what is important to them. And oftentimes suicide and suicide prevention is included in that. And a lot of the work that they do. So we have folks who, champions who in the past, Sam Schimmel and Faith Hullion specifically, who work directly in suicide prevention and intervention. So the things I'd like you to take away is that Native youth, they have to be at the table when talking about making change in these policies, but also if you are working in tribal communities, you need to understand that there are 573 federally recognized tribes. That does not include the state recognized tribes or those who just self-identify as Native American. It's a very diverse population in itself. There's a lot of different cultures in that population, and we are not one. It's not a pan culture. There's not one Native American culture. There's differences, so you need to understand those differences when working with these communities. And that also brings that you need to be culturally relevant and culturally competent in any of the intervention and prevention strategies that you bring to a tribal community. So making sure that you are aware and working towards competency is always important when you're working with Native youth. So making sure that you have that culture and indigenous knowledge included, that's key. So make sure you remember that when you ever have a conversation with any Native person or Native youth. It's very important. So, Siakulo, thank you.
So we're going to start to gather some questions. Okay, so the first question we have is, how do we best ensure that suicide prevention efforts are culturally affirming, such as considering language delivery and outreach efforts? Yeah, sure.
Okay. So a couple things I'll say. One is I want people to understand when we talk about cultural competence, that does not mean that you know everything there is to know about every single solitary. It is about I come from the field that helped develop it. So it really is about understanding that we don't know everything. We can't know everything, and we have to go to the table, go into the conversation with humbleness and humility. And so for me, I think part of developing cultural competence and infusing it into what we do is the first big key. We have to acknowledge that people are different. We are all different from each other. I'm not different from you. We're all different from each other. So I think if we can start from that space and recognize that different things are going to be required. You have 3 individuals who've been up here. Everybody, there's been common threads, but there have been differences. So if we can attend to the idea of differences, I think we can go a long way towards supporting people. And the final thing I'll say is there are lots of examples of stuff that works. We have to build on the examples that are already there. And I'm a big advocate for research. We have to infuse money and support, right? Thinking about appropriations, NIH in particular, that calls for building up of stuff that we already know works well.
The only thing I would add is that it is never wrong to ask a question with appropriate intent. There's a huge difference with cultural, as was said, we won't know everything. We hear from youth all the time, that they were asked, well, are you sure you're gay? Not appropriate, not helpful. You may not be culturally competent to recognize exactly what that means, but that's not you asking about their identity. You're asking, what does that mean to you? There's a huge difference on how you ask the question so that it can frame it as, this is your identity, your diverse population. I recognize that we're all different, so let me learn more about you as you want to tell me, not as I get to learn.
So our next question is, can someone speak on the importance of ensuring that advocates reflect all communities impacted by suicide?
We're looking at you. How to ensure that all communities?
Yes. Do you want?
No, go
Okay,
for it.
all right. So, okay, no problem. So a couple things. I think in each of the spaces, so I'm thinking of advocates, clinicians, researchers, policymakers. Part of what's important is there may not be enough of us to represent all of the different groups that need to be represented. However, if I am a person, as an African-American woman, one example for me is in my research lab. I have all kinds of folks in my research lab, right? And part of why that's important is because our young people of color need to see that anybody with good intentions and a good open heart who's willing to try, as they said earlier, can help us, right? And so part of it is recognizing that we're not going to be able to recruit everybody that we need to recruit to represent all of the populations that we need to represent. However, we can make sure that we engage in every effort possible to engage the different populations that are in our vicinity, right? It's not, most of us don't live in places where there's literally 100% of the people look just like us. There are other people there, but we have to go outside of our comfort zone to reach out to people and say, maybe you haven't thought about suicide prevention advocacy, but I want to talk to you. But we have to come with some knowledge of why that might be important. So now you got stats to talk about, we don't do conversion therapy. We approach any Native American, Indian community with humility. You use that knowledge. You open a conversation. And I think if you know, mi español está mal. But every time I say that, mostly Spanish speakers will be like, oh, okay, well, you try, so we can have a conversation. So I think if we try and come from a place of humbleness, we can recruit the kinds of people that we need to recruit to demonstrate diversity.
Yeah. Does anyone else want to speak on that? Okay, so Dr. Alfie just kind of touched a little bit on this last question that we have, but I'm going to phrase it and then see if anyone else would like to jump in. So how should we at AFSP reach out more to diverse populations in our prevention advocacy work?
I got this one. I got this. So if you haven't guessed, I'm like the greatest fan of AFSP. It's kind of crazy. And all of the different breakout sessions that I've been to today, there's been amazing times where AFSP has mentioned, hey, have you thought about Trevor Project and this action? Have you thought about this and this action? That bridge building is exactly how you do it. You do not say that you know how to do all of suicide prevention. I think the hardest part for us at Trevor Project is that we have volunteers all across the country, but they may not know that the AFSP chapter is super cool with them also being an AFSP chapter member. There's this idea that like you only have so many hours in your day and you couldn't possibly work, like support more than one organization at a time. The whole part about this work has to be saying, guess what? When you do an out of darkness event, make sure you have Trevor Project tabling at that event. When you do an event on Capitol Hill, make sure to mention that if someone says, well, what about X population? There's people out there who are working to do that. We're going to simply be the bridges that get you to those resources. So as AFSP, the best way to do it is, one, to talk about it. If you don't talk about it, the issue doesn't get enough airtime to actually have action. The second is you have to do something about it. So AFSP and Trevor Project and others have regular meetings where we check in with each other and know what's going on. You can do that on a local and state level as well. There is zero reason that it should only be like AFSP and Trevor at the top loving each other. Let's all love each other all over the country. There we go.
Can I add one thing? Yeah, sure. So the final thing I want to add, I cannot build on that but what I will say is that it's important to recognize that each of you has relationships with people. So we've heard Trevor Project. You probably know people of other organizations that represent different groups. If you don't, Google is your friend. I say it all the time. So you Google some groups that are out there doing this work. One of your friends might be this organization that my sister represents here. One of them might be the Acoma Project. There's so many of them out there. If you Google, get on their websites, get on their Facebook pages, for the young people, Get on their Instagram page, right? Get on Twitter, I mean, not so much, but Snapchat, which I still haven't figured out. But if you can go to those places and look up the names of these organizations, you can say to National AFSP, here's some people we want you to engage with. Please bring them to the table to do just what they said.
I think it's a turn on my.
Sure.
Do you have time for a quick question?
Yeah.
So I just have a quick question on introducing or inviting, it was initially with Native American tribes, there's one in our communities in our chapter service area. And unfortunately, they're only known for casinos right now, and that's the truth. But there's a concern, how do you invite and start that conversation to invite to education or open, offer it? How do you
The biggest thing that you need to do when trying to engage or find out, invite tribal members and tribal communities into what you're working on, into your chapters, is find out who the tribal government is. So that's their business committee. Sometimes that's the president, their chairperson. You first got to go, like most tribes have a website. Go to their website, find out who these people are. There's going to be a contact page somewhere on that website. There's going to be an email, phone number that you can call and try and find out who to get in contact with. It just depends on the tribe, on who you're trying to get in touch with. There's going to be a Department of Education most likely on the reservation or in that tribal community, so you can go directly to the school, to the teachers, to those people who are going to be able to enact the most change and kind of get back to you in a timely fashion. But I would start with from top down when it comes to the tribes. You got to go to the people in charge and then work your way down to get to who you need to.
Okay, I'm sorry, can I add to that?
Yeah.
You correct me if I'm wrong. I think the other thing about engagement, we have to be willing to go to people, instead of ask people to come to us. Because is that wrong? Because if we ask people to come to us, we're asking them to come into the space where we are, where we feel comfortable. And I think with underserved populations, we get tired of that. I'm just gonna tell you as a Black, I'm tired. So I need you to come to me with humility, right, and saying, we wanna collaborate, not I want this and this and this and this from you. I'm willing to offer this, and in exchange, I hope that we can figure out some mutually, that's your language, mutually agreeable path forward. So that part about going, right, not just inviting, I think is key.
Yeah, and that's because a lot of communities are isolated.
Yes.
You have to be able to be willing to go to them in order to help provide support and services to them, and vice versa.
Can I add? Sorry, I'm from Alaska. I'm Alaska Native. I just want to add to that. Is just when you're going to a smaller remote village or community, just ask for one of the tribal leaders. Yes. Get permission to go to that community first. Just out of respect. Yeah. Thank you.
Thank you.
Thank you.
I think we have time for one quick question.
I'll be really quick. My question is probably for Tasha and Dr. Britton. So is there a place that we can go that has like a paragraph or a PowerPoint or something that talks about the intergenerational trauma, like the post-traumatic slavery, like the boarding school intergenerational trauma that the youth are still experiencing? And so is there some source that you like to share that we might be able to share that with our?
Yeah, I would honestly plug Center for Native American Youth. Go to cnay.org, the resource exchange. You can find almost any topic that you're looking for there in our blog. We have youth who come and share their stories with us and talk about that. We also share any other resources that are submitted to us from any organization and varying person who just wants to get what they have out there into the world. So if you're looking for that specific thing, go to our website, go to the resource exchange, look for it. You should be able to find it there. And if you don't, reach out to us so that we can try to find the person to get you in contact with, or so we can cultivate that information for you.
Amen. And acomaproject.org, you can go there too. It's all one word. I think it's in the flyer. Acomaproject.org. I can spell it for you later.
Okay. Thank you.
Great. Thank you all so much for coming to the session today. I want to thank Tisha, Sam, and Dr. Alfie for being here, and thank you all for participating.